The Sinai Medical Foundation Oral History Project is being conducted by Leonard N. Simons Jewish Community Archives. My name is Brian Chamber, and today's date is December 4th, 2023. I am interviewing Dr. Leon Hochman. Hochman, thank you. Dr. Hochman, do you give permission to the Leonard M. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes for use as deemed appropriate by the archives?
Yes.
All right, thank you. We'll begin with a little background information on yourself. Can you start with where and when you were born?
I was born in Detroit, Michigan, August 9th, 1943, at Grace Hospital.
Grace Hospital. Any more information that you'd like to give on your upbringing? A little more information on your upbringing?
No.
No? Who or what inspired you to become a doctor?
That would be something about my upbringing. My father was a physician. He was a general practitioner. And my mother told me that when I was 3 years old, I used to say, I want to be a daddy and a doctor. And that continued throughout my life. I still say that, but it was very influential. My father was very influential in me becoming a doctor. He used to take me to his office, and I'd sit there while he was seeing patients. I'd go through his medical journals and look at them. He used to take me on rounds to the hospital. So in those days, you couldn't go into the patient's rooms, but you could go to the nursing stations. So I found that all of that very interesting. And he also took me on house calls, because in those days, general practitioners did house calls. So if he had a call to go to somebody's house, I would go with him. He'd drive me in the car. I'd sit in the car while he went in and saw the patient. We would talk a little bit after, nothing about, the patient's history or anything, but he would tell me that this person had, some kind of illness or whatever, but we didn't go into any depth. But it was an interesting experience because I got the feeling of what it would be like to be a doctor at that time, to one, go to the office, two, go to the hospital, and three, make house calls. The other thing I remember is that when he was on call, we didn't have phones like we have today, so he had to give answering service numbers, and the answering service would call our home. You couldn't carry a phone with you, but you could have a beeper or something like that. Even the beepers, I think, came in later, though, when I was older. But I got a flavor of how a doctor was contacted at that time.
Where and when did you go to medical school?
I went to medical school at Wayne State University from 1966 to 1970.
Can you tell me more about that experience?
The medical school was a very interesting experience for me. First of all, when I transitioned from high school, from grade school to high school, there was more work, there was more homework, there was more studying and everything like that. Transitioning from high school to college was way more than that. More intense, more assignments, more work to do. When I went to medical school, it looked like all of that looked like nothing, because medical school was, from a study standpoint at that time, was very intense. I remember I stayed in the anatomy lab for hours on time. Sometimes I'd go in the evening and stay to midnight, walking amongst different specimens or on different anatomy tables, so I could identify different organs and blood vessels and things like that. The study was intense because sometimes we had a lot of courses at one time, and then we'd have exams. At one time, I had an exam, I think, of about 4 or 5 courses in 1 week, so it was difficult to study between one and another. On the other hand, we had a good time in medical school, so we'd go out for lunch. really outside. There was a cafeteria that you could take food outside. Sometimes we'd play football outside during lunch. Sometimes we'd go to the Stroh's Brewery, which was close by, either before or after. So my involvement in medical school also was, I became involved, this was a time of a lot of student activity. It was during the Vietnamese War. As students, we become active in certain social issues. When I went to medical school, this was during the riots. So in '67, we used to drive down the expressway, and there used to be policemen stationed on the bridges with rifles. So we had a little bit of concern about driving down to medical school, but we went every day, that was a unique experience. In the summer, I was a scrub nurse at Henry Ford Hospital. And I was there when they brought in the first policeman that was injured. And then I scrubbed on different operations, not necessarily related to the riot, but and I learned how surgeons operated, how long it took. I watched what the scrub nurses did. I did some of that work, so that was also very interesting.
Moving on from medical school, can you tell me a little bit about your residency and how you ended up at Sinai?
So after medical school, we applied for internships, basically. You didn't, at that time, apply to a specific specialty. You needed to go through an internship. So there were 3 hospitals that I applied to, Sinai Hospital, Sinai Hospital, I think it was Detroit Receiving Hospital, and Beaumont. And so then I was accepted. The hospital that I wanted to go to for my internship was Sinai. I got it accepted to Sinai, and a lot of my classmates also got accepted, so I knew a lot of the people that were in my internship class. So then on to residency. After internship, you went on to residency. You had to apply for residency as well, but I applied to Sinai, got accepted in residency there. I want to go back to internship a little bit. I didn't have anything to compare internship with, but the internship at Sinai was very intense. We were responsible for a lot of things. We used to have to, we came in the morning and made rounds with the attending physicians. After 6 o'clock at night, we had to do all the histories and physicals that were admitted to the hospital. And many times there were surgical cases that were also admitted. Nowadays, they do it as an outpatient. The doctor knows the history of physical or brings it with him, but then the interns were responsible for that. We rotated through several services, mostly by choice. As I remember, I think I went to radiology, psychiatry, internal medicine, OB-GYN. So it was, we were responsible for a lot of things too. So if somebody came to the ER after 6 o'clock at night, we were responsible for call to the ER after that. And we were responsible later on in residency for first call to the ICU after a certain time. So there was a lot of responsibility that was involved. Moving on to residency, there was a lot of responsibility in residency as well, but then we were primarily focused on just the OB-GYN aspect of residency. So we were responsible for watching people in labor. We were responsible for taking them to the delivery room, which was right across the hall. We were responsible for giving anesthesia frequently. So we learned how to do spinal anesthesia, but mostly caudal blocks. but other types of anesthesia as well if we weren't going to use that. We had to be on top of things because if a woman was starting to deliver, it was much more difficult to get the kind of anesthesia that the doctors wanted. And then we scrubbed on all of the deliveries, and the attendings were, depending on our expertise and our year of residency, would allow us to do different things. And by the time we were senior residents, we could do just about everything. Usually still supervised, but a lot of times we were alone at night and people would come in active labor. We'd call the attending to have them come in, but we were responsible all the way through and with delivery. The other thing is in internship, going back to internship, we were responsible for hanging all the bloods. So if somebody had a blood transfusion, we did it. Today they're done by technicians. If an EKG needed to be done, we did that. If a cardiac arrest occurred, we were first to the cardiac arrest, although a team came by. We gave certain medications that had to go through IVs, and we started all the IVs. So there, again, a lot of this stuff is done by techs now, but we were responsible for all that. And that was true, actually, as residency went on. In the beginning that was true, but later on, the nurses started IVs when patients came in, and some of the other things.
Thank you. Was there anything that drew you specifically to the field of OB-GYN?
Well, I had to make a decision about what specialty I wanted to go into, and that's why I rotated through a number of specialties when I was an intern. So I looked at three possibilities. One was internal medicine, one was psychiatry, and one was OB-GYN. So, and I liked all of them. I thought that all of them were very interesting, but I found OB-GYN especially interesting for a lot of reasons. One, you could do internal medicine or general medicine being an obstetrician gynecologist. Some people did a lot of that, in practice, and some people didn't do a lot of that, but that was something you could do. So that satisfied that interest. Psychiatry, I liked because there was a lot of psychiatry involved in OB-GYN. Women sometimes became depressed, or they had emotional issues during pregnancy. They had sometimes emotional issues afterwards. Sometimes they had marital issues. So this was another thing that interested me, and OB-GYN allowed me to do that. And then surgery. I liked doing surgery, but I didn't like being at the table for hours on end. So I found that the kind of surgery was done in OB-GYN, deliveries, even including C-sections, other than when people were in labor or whatever, lasted about an hour. C-sections sometimes lasted 2 hours. But you could do a lot of different surgical things when you were doing OB-GYN. And so I decided that OB-GYN was a combination of almost everything that I was interested in, and that's why I chose it.
During your time as an intern and during your residency, can you describe the culture of working at Sinai?
Well, when I first came to Sinai as an intern, I really didn't know much about Sinai because most of my training was in Detroit hospitals, Detroit Receiving, Harper Hospital, and my rotations were through there. So when I came to Sinai, I really didn't know what to expect because one, as a student, I wasn't responsible for very much, and two, I didn't know what the culture of the hospital was like. But I found it very welcoming. I found the attendings attentive to the internships and a desire to train them. I found the nursing staff very efficient and good and respectful of people in training as well as the attending physicians. I found that you could turn to people if you had a problem, either in taking care of a patient or in the ICU or in the emergency room. There was always people available that you could look to and talk to if there was some kind of problem. So I found the procedure overall very welcoming and helpful and instructive.
As a Jewish doctor, what was it like working at Sinai as compared to some of the other hospitals?
So I really wasn't a doctor when I was in training, but I rotated through different hospitals. There wasn't this sort of warm feeling about being in these hospitals. It was more cold, but I was emotionally cold, but I was a student, and so I was trying to learn everything I could, and teachers were very good, but it was a different experience. When I came to my internship, it was like coming home to a certain degree. There was this Jewish feeling to the hospital. Jewish holidays were celebrated. The attendings were mostly Jewish. So there's this feeling of being in a place that respected Jewish people, looked up to them, and it just felt, like I said to begin with, like I was home.
What positions did you hold at Sinai, if any?
Well, in the initial phase, as I said, I went through internship and residency. Later on, I sat on the SEC board, Staff Executive Board. The way it worked is that the departmental chairmen were part of the SEC board. The board was run by the medical staff president, and then there were elected members from the different departments. In OB-GYN there was 2 members. I don't remember if every department had 2 members. I believe that some had 1. So I served for maybe 3 or 4 years initially. Then I went off the board for a while, and then I came back for another 3 or 4 years. And that was an entity that discussed a lot of issues as far as the hospital was concerned. Patient issues, medical issues, departmental issues. So it was a very interesting experience for me to be on that board. And the other issue of, position of importance was I was the president of the PHO board, the Physician Hospital Organization Board. The executive director of the hospital asked me to be the president. And this was a time when medicine was going through HMOs and trying to produce how the hospitals were going to react to physician hospital organizations and what kind of billing there was going to be. And so we had meetings of different doctors to determine how we were going to do that, what kind of expenses there would be, what kind of charges there would be. So that was also a very interesting position. And the final position was, it really wasn't an elective position. There were a group of doctors that got together when Sinai was having financial trouble, and there was a real chance of it closing unless certain monies were collected or unless more admissions occurred, and I sat on that committee.
When was that committee formed?
You know, I'm uncertain of the date, but it was close to the end. So I think Sinai closed in 1999, and this might have been in 1997 or 1996, something like that.
Can you tell us about any medical advancements in your field that occurred at Sinai, and if you played any role in them?
Well, there are medical advancements in Sinai or medical advancements in my field?
In your field.
Okay. So in OB-GYN, Sinai was very progressive in studies, in invention, and so when new things came out, they were frequently the first to initiate those in a hospital. So laparoscopy came out, which was being able to look inside the body through a scope and do certain things. Mostly it was diagnostic in the beginning, so you could look in and see if there was an ectopic pregnancy. or there was some organ problem or blood in the abdomen. However, later on this developed into a much bigger deal, and it was surgical issues that could be done through the scope. Sinai was also in the forefront of laser development, and as far as OB-GYN was concerned, there was a use of laser for certain kind of vulvar abnormalities, precancerous lesions mostly, but sometimes treating other types of problems, and also treating of warts, and also treating of surgical abnormalities, including condyloma, which are warts, and of course, the treatment of up and to, including carcinoma in situ of the cervix. So, and these were done at Sinai in the beginnings of those types of treatment. As well, Sinai taught a course in Sarasota for a number of years, and they asked a number of the physicians that were in the department to be instructors. I was one of those instructors. So I was able to show other doctors who came to this. This was a general meeting for doctors, mostly OB-GYNs, but because we were presenting that kind of treatment. And so I was one of the teachers that showed them how to do the laser, how to use colposcopy, looking through a microscope to see what the lesion was, and treatment.
And over the course of your time at Sinai, can you tell me how the culture changed, if it did at all?
So, in the beginning, as I said, it was a really warm, comforting, welcoming type of place. And I think that really continued throughout most of it. However, nearer to the end, there was more angst about the hospital surviving. There was more concern about what was going to happen. There was issues that came up, what could be done. And as I said before, I was on this committee that was formed to see what we could do to increase volume to the hospital and patient pay or reimbursement. And then the culture changed somewhat more to more of an anxious type of atmosphere. Still the same collegial atmosphere that was observed before, but this was now doctors getting together to save the hospital.
I'd like to focus a little more in on the relationship between private practices and full-time hospital staff. Could you tell me about that working relationship?
So the way the hospital worked with private staff, and most of the staff, at least in the OB-GYN department, was private, and they would bring their patients to the hospital and manage the patients and do whatever was necessary for deliveries or surgical procedures or whatever. As the hospital staff was more related to departmental chairmen who directed the department, set the tone for the department, introduced new concepts to the department. So, and there was interaction between those people because they were really there for many reasons, and they had a number of different jobs. They had, not only was the job instructive, but it was also administrative, and they had to spend their time on administrative issues to try and make the department better, make the ease of practice better. But there was always this good communication between the hospital staff and the attending staff. And also, as I said before, when I became an attending, I was responsible for training interns, and the interns, the internship, the residency changed because when I went through the residency, you were an intern to begin with, and then you went into residency. Later on, you started out as an OB-GYN resident, and that was 4 years. Before, it was 1 year internship and 3 years of residency. More
generally, what was your favorite part of working at Sinai?
I think I mentioned it. The atmosphere at Sinai. It was. It wasn't a religious atmosphere from the standpoint of, people praying or anything like that. But it was. You knew you were among Jewish people. You knew that you didn't have to be concerned about anti-Semitic kinds of talk or discrimination, which occurred at other hospitals, actually. And so that was probably my favorite thing. And also the investigative aspect, the innovative aspect among the staff and among the departmental chairman. So there was a lot of intellectual stimulation at Sinai. And even the aspect between the attendings and the nursing staff was very good. The nursing staff was good. One of the reasons is that they had a school of nursing, Shapiro School of Nursing at the hospital. And so they were trained as Sinai people, basically, and they had experienced Sinai. And their interaction with the doctors was quite good.
And conversely, what was your least favorite part of working at Sinai?
That's a difficult one to answer because my experience was mostly positive. I would say that negative aspects were, I always felt that the hospital should have been more proactive in looking towards the future. However, I think that they made a number of attempts to think about the hospital going into the suburbs. My understanding was that there was a wing of the hospital called the Fisher Wing that was built, I believe, in the probably the late 60s or mid 60s. That hospital could have been built in the suburban areas. There was no certificate of need that was necessary. Now, I don't know if this is true or not, but my understanding was that Max Fisher, who the wing was named after, the Fisher Wing, was fairly insistent, along with other Detroit leaders, that that addition occurred in the attached to the Sinai Hospital. Had it been done in a suburban area, Sinai probably would have survived. Even if it wasn't in Detroit, it would have survived in the suburban areas. And also, just as a general statement, the Jewish community used to move almost as a group. It was in Detroit, it moved to northwest Detroit, then it moved to West Bloomfield or Oak Park. That stopped as well. People started not being so in the same community. So when the hospital got older, sometimes it was more difficult to bring people to the hospital because it was in Detroit and they didn't want to travel to that hospital.
Well, that kind of harps on the next question that I was going to go into, which is the sale of Sinai. What were the feelings that you had at that time?
I was very disappointed because I really thought the hospital had a chance to survive and even go into the suburbs. Before all that occurred, Sinai years before, many years before, it might have been even in the 50s or 60s, was talking to Ford Hospital about possibly building a hospital in the suburbs. Again, there was no certificate of need at that time necessary, and I think it might have been even in the late 50s that they were talking about it. But that didn't happen, and then nearer to the end, Sinai tried to get together with Ford again, and that fell through. They tried to get they tried to get it with University of Michigan, and for whatever reason, that attempt fell through. But it became more difficult to get this certificate of need. A lot of times it was based on what the hospital capacity was and what the use of the hospital was, so it made it more and more difficult to do that. As you know, I think that Henry Ford was successful in going out there, and unfortunately Sinai wasn't part of it. And I also believe that Providence was involved at one time, that they were trying to do some kind of business arrangement with them so that they could go out into the suburbs. Once again, that didn't happen. So I was concerned and upset that for whatever reason, it didn't seem to be that leadership could produce that kind of amalgamation.
And I'd like to focus again on the hospital staff and what their feelings were like. What were the feelings around the sale amongst other doctors at that time?
Well, I think there was a feeling of anxiety. There was a feeling, ultimately the hospital got sold to the Federation, I believe. And I think it was for around $61 million. And then there was a question as to, since the hospital was sold, what hospital would remain? And everybody wanted Sinai to remain as the hospital. Sinai had a very good reputation in the community. It was probably one of the best hospitals in the city. It was looked to in that way. Bowman was still at that time up and coming, but it wasn't the hospital that it is today. Henry Ford was always there, but it was in the center, downtown, basically. So anyway, DMC became involved, and so Sinai got its name placed on Sinai Grace, and Huron Valley became Huron Valley Sinai. So, and that was done to persist in the feeling that Sinai was still existent. However, it was totally lost. Unfortunately, if anything occurred, it might have been more in Huron Valley than in Sinai Grace.
From your perspective, how did the hospital change from the time that you started at Sinai to the end?
Well, as I said about my internship, the interns were responsible for a lot of things. It was a terrific learning experience. But as time went on, internships were eliminated, and that you went into residency in the beginning. They might have called the first year like a internship, but the residency wasn't the same because you didn't rotate as much through different specialties. It became more sophisticated relative to delivery of care. You weren't involved in anesthesia, giving anesthesia anymore. You weren't involved in doing all these other things that I said interns did. A tremendous responsibility. And I think in that respect, that decreased the ability of some doctors who came out of residency later on versus the ones that went through internship and then into residency.
Who are some of the people that were most influential on your career and why?
Well, I would say probably the most influential person in my hospital experience was Dr. Alfred Sherman. He was a very innovative man, a very kind man. He really loved to teach. He was very protective of his residents. He came from a research institution, I think, in St. Louis, and then, but he was always interested in research. So as I said before, the use of lasers, he was involved in as applied to OBGYN. Dr. Sherman was also a gynecologic oncologist. He could stand at the operating table for hours, which we accompanied him in training and even after training. He was a person who taught in a certain way. Some teachers that I had in medical school or later on were more critical, and he was more instructive. So if you weren't doing something right, he didn't take over. He would tell you this is how to do it or show you how to do it. If the operation took more time because you were learning, that was okay with him. After I got into practice, I used to scrub on cases with him because they were oncology cases, but I would do part of the surgery and then he would do the oncological part. And he was always willing to do that with attending physicians. I remember when we were studying for boards and nervous about studying for boards or whether we would pass or whatever. So when we took our boards, or in other residents before me, he had an in with the board. As a matter of fact, I think it was a board a questioning person, and he could find out how you did, and that was a very nice plus, because not so nice if you didn't pass, but nice if you passed, so you didn't have to continually worry about it. He's just a terrific person, this man. I admired him greatly. Other people in the department, Milton Goldrath, who also was a chairman, I think after Dr. Sherman stepped down, and it was temporarily until they could find a new chairman of the department. But he was also an innovative person and used laser and thing that I forgot to mention before, they applied laser to certain conditions of the uterus. When women had menorrhagia, frequently the only treatment was hysterectomy. But then they developed a technique of ablating the endometrium. First it started with electric hoops, where you drew the hoops across the endometrium and took off, it burned off the layers of the endometrium until you got down to the next layer. And then people wouldn't menstruate as much, or if they did menstruate, it was minimized. So, and that was something that Dr. Goldrath was involved in a lot. And also, with the development of laser, ultimately they used laser to do the same thing, and that was much more efficient and easier to do than this loop excision. Furthermore, doing ablation of the endometrium, there were different other techniques that became involved in doing it. Certain kinds of heating techniques or whatever. Dr. Goldrath developed a technique called hydrothermal ablation, where there was a balloon inserted into the endometrium. It was very hot, and I think before the balloon there was water that was infused, a very hot water that was infused, which removed the endometrial layer, and so menorrhagia either was reduced substantially or eliminated.
How and when did you become involved with the Sinai Medical Foundation? How and when did you become involved with the Sinai Medical Foundation?
The Sinai Medical Foundation was established right after Sinai closed. Maybe in 2000, the Sinai closed in 1999. There was a Sinai education fund that took care of indigent patients or patients in the Schiffman Clinic. And the doctors agreed not to collect those monies for themselves. They were manned by attending physicians and interns or residents. But there was a certain amount of money that was paid by the government to take care of these patients, and they did not take those fees. I believe sometimes there might have been some insurance that was involved, but again, they didn't take those fees. And so there was an amount of money that was collected, and the doctors that were involved in the education fund decided to keep that fund out of the sale. I mean, it wasn't part of the sale. and they developed the Sinai Medical Education Fund, not Sinai Medical Fund. And that fund was to do several things. To encourage medical students to be able to continue with their medical studies, or at least to help them out. So there was scholarships that were made available to different medical schools. At the time that it was established, there was two medical schools, University of Michigan and Wayne State, and then there was also, I'm not sure the time that this occurred, it might have been near the beginning, there was Michigan State School of Medicine, and then Michigan State School of Osteopathy. We contributed about $250,000 to the three schools, the medical schools, each one, and that money was used, as I said, to help medical students pay for their education. We also had a philosophy about giving research projects money. And so it could range for anywhere from $5,000 or even less sometimes, up to $250,000. So there were some projects that we invested in extensively, one of which was with a neuro department in the University of Michigan. And also there were other research projects that people would apply for, and that we would consider and decide whether we wanted to give money to that. And then there were some community projects that occurred. So in helping somebody establish a medical clinic, or service a different or a certain type of population. So we contributed money to that. Interestingly enough, I'm not sure this is totally accurate. I think we started out with $2.5 million. The fund started off. We've given millions away. And now the fund is worth about $5 million. After giving that money away, and through investment and things like that, the fund has increased. And when it increased, we were able to give more funds away. There was a certain requirement by the government that you had to give a certain amount of money based on the worth of the fund. And sometimes we exceeded that because we were able to do that. But most of the time we met that number, and we would meet to decide what we wanted to contribute to. And we asked them for documentation and to have feedback relative to what they were doing with the money. When we gave money away, we asked them for some sort of recommendation to the fund. So it was pretty extensive that one, we gave money away, and two, that we got recognition from it. And also the medical students every year write a letter of thanks to the fund for contributing this money.
Is there anything else that you would like to discuss that you haven't mentioned yet?
Well, you know, you asked me about the culture of Sinai, and the culture at Sinai was what I said it was, but this extended to the nursing staff, to the non-nursing staff, to the kitchen, to the janitorial staff. I mean, all these people had a feeling about Sinai, much like the feeling that I had. I had some patients after Sinai closed, many years after Sinai closed, and we used to talk about Sinai. And everything they said is, I miss Sinai. They went to different hospitals. Some of them said never the same. So there was this atmosphere that everybody, for lack of a better term, bought into and recognized, that produced like a family type atmosphere, and people wanted to come to work and do their work well, whether it was a doctor, attending staff, employed staff or nurses or other staff, and everybody, I mean, there were tears when Sinai closed. And so, and that feeling went on. And I've never experienced that feeling in other hospitals. Maybe that I didn't grow up there or whatever, but it's not the same. And also, a feeling of being in a Jewish hospital was very important.